Hey guys, it's Dr. Heather Moore, owner of Total Performance Physical Therapy. Let's talk about how to turn our head when it hurts. So this is a really common problem, especially when you sleep wrong and you wake up and I don't want to say a lot of times, but it's generally occurred at least once in all of our lives where we've woken up and haven't been able to turn our heads much past this or even less than that. And it's either sending a shooting pain or sending a sharp pain or just it hurts too much to turn. So what do you do when that happens and how do you turn your head? Because this is how most people wind up going through their day at that point in time. And that's fine, but we do want to talk about some strategies besides that that are going to help you to get that range of motion back. So it's important to address two things. First of all, we need to figure out where that pain is coming from. And did you sleep wrong? Or is it more of a nerve pain? So one of the things that I want you to decipher right away with that is there a sharp pain? Is there like an electric pain? Does it feel like you've been stung by a bee almost? Or is there pain shooting down your arm? That's indicative of a nerve involvement. Numbness and tingling, sharp, electricity. Those are words that we use when we're talking about nerves. So if that's the type of feeling you have, that is something you do want to get treated right away. It's not something that you want to really wait and figure out. You want to talk to your healthcare professional ASAP because that's a nerve involvement. That means there's some inflammation going on, possibly a disc herniation. So you want to really make sure that you are addressing that correctly. Otherwise, you can wind up with some permanent damage or you can wind up with some weakness in your arms. It's not going to stay to your neck area only. When you're dealing with shock waves or shocks going down your arm or anything that you would describe as an electricity. So what we're going to address tonight is that pain where you just kind of turn it and it's really sore and it hurts, or maybe you just can't turn it past this point, but there's not that shock. It's not, jolting. It just really hurts. You slept wrong. Some people refer to it as a kink in their neck. Sometimes it happens on vacation when you're sleeping in a new bed. These are the types of symptoms that we're going to address tonight. So when you're talking about turning your head when it hurts, you really want to avoid this as much as possible, okay? This like Frankenstein-esque move your whole body when you are hurt, because you want to try and get that range of motion back as soon as possible. So the first thing you want to do is take that hot shower. I don't recommend putting a hot pack on your neck. You really don't want anything that hangs on your neck. So I would definitely start by taking a warm shower, and I would not get on any device until this is resolved. So if you're sitting there like this, or you wake up and you're somebody that grabs their phone right away and you're like this is going to aggravate it. So even though this motion may not irritate it, doing this and being in this posture is going to prolong how long it's going to take you to turn your head. So what I recommend is if you wake up like this or you find that you can't do this, if you're able to take a warm shower right away, go ahead and do that. Now, if you can't do a warm shower, we're going to do the same exercises with or without the shower, but that warm shower kind of beating down on your neck is going to help relax some of those muscles. So you can do this while you're standing in the shower, or you can do this just when you wake up. You want to first of all make sure you have good posture. So you're going to roll your shoulders up, back, and drop them down. Now, when you have that neck pain, you may not be able to bring them all the way up, and that's okay. Just roll them up, back, and then drop them down. You don't want to pin them back like this, okay? And you don't want to be guarded like this. All right, so just up, back, and drop them down. That puts them in good position. That puts your neck in good position. Then what you want to do is you want to start to just gently turn your head in the direction of the pain and then in the direction where it doesn't hurt. Now, when you turn it in the direction that it hurts, you want to stop where it's uncomfortable. You don't want to push it to the point of pain. You don't want to jam it over. You want to just gently turn it and then turn it back. And then turn it to the other side and turn it back. Now, these are very slow motions. You want to take maybe 30 seconds to get there and back, trying to get a little further each time. Now, maybe you don't, and that's okay. But it's that repeated movement. You want to do this for about 5 minutes. This is not, do 10 reps and done. You really want to make sure that you are moving in that direction as much as you can. Now, you want to then go side to side. So this is the motion. Again, you want to move in the direction that it hurts, but you want to stop right before it's really painful. You want to stop where it's like, okay, and then go to the other side, nice and easy, and then go back kind of side to side. Again, 5 minutes. If you have that hot shower on you, great. But really just kind of nice and slow movement, moving into the side that's not painful and then moving to the side that is painful. Finally, what you want to do is you want to just do some gentle neck circles. Now, maybe that's just here for the time being. Maybe it's a little bit bigger. All right. Again, as you're doing these neck circles, clockwise and counterclockwise, you want to get them as big as you can, but you want to get them bigger each time. So even if you're starting off with a very, very tiny roll, you want to make sure that you try and open it up each time. You may not be able to, and that's okay. Don't just do these in the shower. Don't just do these first thing. You want to do these throughout the day. If you haven't noticed any improvement from the shower or from the morning, you want to stay off your computer as much as you can. You want to stay off your devices as much as you can. Or if you have to go there because that's where you work, you want to make sure you're getting up every couple minutes, every 15, 20 minutes, just to reset everything. And then just running through those simple range of motion exercises. Don't try and jam it into any position. Don't try and yank on it when it's sore. It's best just to allow yourself to do very gentle range of motion to regain that full range of motion. If this persists past 2 or 3 days, you definitely want to get this treated. This is not something to ignore. It's your neck. We don't want anything further to happen. If you or someone you know is suffering from neck pain and wants a free consultation with a doctor or physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.